My name is Jeffrey Carlson. I'm an orthopedic surgeon at Orthopaedic Spine Center in Newport News and specialize in reconstruction of the spine. I get lots of questions about spine surgeries. One that frequently comes up is about scoliosis. We deal with mainly adult scoliosis rather than pediatric scoliosis, and the age preference generally is over 18. The reason why we think about that separation is when growth plates are closed. In kids, scoliosis can happen as they grow. It can happen as young as infants. It can have curves in the back, and as they grow, as their bones grow, as they mature, they can have a worsening curve in the back. In adults, that curve can be left over from what happened when they were children. That curve can be there from their growth spurts or from the alterations in growth of the growth plates as they grow as kids. It can also happen from arthritis. As the discs wear out, sometimes they don't wear out equally, so one side versus the other tilts and causes a bit of a scoliosis. When we think about scoliosis, we think left to right. So when someone stands with a curve in the back, we think the curve is going left to right. But because we're three-dimensional, the curve is actually a rotation of the bones. So the bones shift or turn. So even though we get a left or right curve on an X-ray or when you're looking at somebody, you actually from the side view may see a lack of curve or a loss of the curve of the back because the bones rotate. That rotational structure or dysfunction that's there can also pinch the nerve roots in the back. With progression of the disease, progression of this curve and increasing the amount of curve, you can also pinch the nerve roots and cause pain going down the legs. We call it spinal stenosis. So as we age, if that curve gets worse, the arthritis gets worse, we can start worsening pinching of the nerve roots. We think about surgery in those patients that have neurogenic pain. When you have neurogenic pain going into the buttocks and hips, that's coming from the back and that's pinching the nerve roots from the scoliosis. So that rotation, that curve that happens there, as it rotates, it pinches the nerve roots, causes pain in the buttocks and hips. We generally don't see that in patients with a curve less than 30 degrees. So when you see an X-ray, the doctor does an X-ray of your back and you measure those curves, less than 30-degree curves generally don't cause any more pain than someone with a perfectly straight spine. In those over 30 degrees but under 50 degrees, about half of those folks will have some compression, and that can generally be treated with some physical therapy, injections, and medications, that kind of thing. When the curve gets over 50 degrees, almost everybody in that category will have some compression of the spine and will need a surgical treatment rather than a non-surgical treatment.